I'm Stephanie Grosso. I'm from St. Anne, Illinois. I'm a physician assistant in the emergency department. I've been a PA for about 15 years. So I was diagnosed with bicuspid aortic valve. I would walk just a few feet and my heart rate would skyrocket to 140. I would get very short of breath. And I was always very athletic growing up. I played volleyball in college, so this felt more than just being out of shape to me. I would get very dizzy and just fatigued very easily. My symptoms are kind of brushed off as stress and anxiety from working in an emergency department, but having that medical background, I knew that there was something more going on. And so when I found out my diagnosis from a local cardiologist, I did research, and Northwestern has a bicuspid aortic valve program, so I knew that's where I needed to end up, and that's how I met Dr. Puthumana. Dr. Puthumana sent me for a stress echo, and that's at the point where the echo did actually show how severe my disease was, to the point where I couldn't even get on the treadmill to do the stress test. Dr. Puthumana referred me to Dr. Malaisrie. I had a video consult to discuss the surgery. There are a couple different options. The first recommendation would have been a mechanical valve. However, with talking with Dr. Malaisrie, I wasn't comfortable with that because I didn't want to be on a blood thinner for the rest of my life. At this age, we are hopefully wanting to pursue another fertility round. We wouldn't want to be on the blood thinner. My initial thought going in was to have a tissue valve because I've had other family members with open heart surgery, and that's what they did. And that's when he told me I was a candidate for the Ross procedure.
Most patients with aortic valve disease are older and they can get an artificial biologic valve, but there is a smaller subgroup of patients, younger patients, less than 50 years of age, who have valves that cannot be repaired. The Ross procedure is perfectly positioned for a patient like this. Take the patient's diseased aortic valve out, and we use the patient's own pulmonary valve as a replacement. When we move the healthy pulmonary valve to the aortic position, we have to replace the pulmonary valve. In that case, we use a human pulmonary valve, which is frozen. We take the patient's own healthy pulmonary valve is because it's a living valve. We think that the patient will do better with their own parts, and they can live with a pulmonary valve for a long time with excellent durability.
A Ross procedure was not even on my radar. So when he said if I didn't want mechanical valve, I was a perfect candidate for this, I didn't even second guess that's what I was going to do. Within a few weeks of having the consult with him, I was in for surgery, and I just knew I was going to be in good hands. I had the most amazing care here at Northwestern. I referred patients up here, and the nurses, the techs, everyone that I came in encounter with was amazing. I went to cardiac rehab back in my town, so I was off from the ER for a total of 3 months. The fact that everyone came in with a smile on their face, you would never know that they were busy, my surgery was during COVID, so that was a whole nother process. You would never know anyone who had outside stressors because everyone was just so kind and caring. It's important to find a provider you have full trust in because it is your health and your heart. Talking to my husband, I decided post-op that I wanted to do a Run Disney race because I like Disney. And if I was gonna, go through heart surgery and get better, I'm like, well, I might as well do one of those races. And I have been running ever since then, and I never was a runner before. I've now have done 57 Run Disney races. I've done 15 half marathons, 3 full marathons, and I'm actually getting ready to run my first Chicago marathon this year. Having this surgery has just really increased my health to be able to do all these things that I never knew I would enjoy doing or that I couldn't do before. And none of this would have been possible without the team here at Northwestern.